Now, are you thinking about having a hip replacement? And if you are, I've got 5 questions that you have to make sure that you ask before you have the surgery. And we're going to go through that now. Now, there are 5 things that you have to make sure that you ask yourself before you book yourself in for a hip replacement. We're going to go through these 5 things now because I think each one of these 5 points are absolutely pivotal in making sure that the decision that you're making prior to having a hip replacement or to having a hip replacement is the right decision for you. We're going to go through these 5 things now, and I want you to let me know if you've done all these 5 things, and if you haven't, I want you to tell me why in these comments, because I want to understand. But like, also, if I'm making a bit of sense, well, you know what, if I'm making no sense, I want you to let me know as well. Number 1, have you tried physio? Now, I know this sounds really simple, and it probably sounds stupid me even suggesting it, but you have to consider the fact that some patients will have pain and live with it. They'll go to their doctor and have an x-ray, that's showing an arthritic hip. They've gone to orthopedics, and sometimes physio doesn't get mentioned. Why? Well, because you've got a bone on bone hip joint that's causing pain, and you just need to have a hip replacement. But we're in the day and age now where we understand that patients can have pain and patients can have no pain, dependent on what their radiographical evidence is showing. Essentially meaning that your x-ray could be really bad and you have no pain, or your x-ray could be really good and you don't have much pain, or you have a lot more pain, sorry. So the correlation isn't there. So we can't base it just on an x-ray. Now you've got to consider that patients who are due to have a hip replacement have certain risk factors that contribute towards it. Some are occupational, some are skeletal, like FAI and hip dysplasia, of which you struggle to manage yourself for sure. But also there are other lifestyle risk factors like obesity, weight, lifestyle comorbidities, all of these things that you could potentially influence in a positive manner. Now, physio can be so supportive in being able to do that, making someone a little bit more confident to move, making someone a little bit more physically able to exercise. Those are key things that sometimes can really slow down that symptom presentation. Is physio and exercise going to reverse an osteoarthritic hip? No, but it can certainly make it less painful. It can certainly make it more manageable. And also, what's the worst case? You have physio, it doesn't work. Well, you've spent 3 months educating, advising, and making someone a bit stronger and a bit more active. All of those things can funnel into positive influences for someone that's going to have a hip replacement later in the future. But it's something that we cannot overlook, and unfortunately gets overlooked way too often. Well, ultimately because hip replacements are fantastic and surgeons are really great at doing them. But that brings me on to my second question. Are you sure it's the right decision for you? And what I mean by that is, have you tried all the other options? And are you sure that a hip replacement is the best procedure for you? Because there are other alternatives. You have to consider the fact that hip health is on a continuum. Like I've said this before, nothing at all here, severely arthritic here, and varying levels of severity. But then you've also got those precursors to arthritis that often are there as a result or in conjunction with those that have kind of predispositions like hip dysplasia or FAI syndrome, hip impingement. Now, sometimes patients might fall into that early mid category that might not be as textbook as the patients who are waiting to have a hip replacement with a severely arthritic hip. And maybe the question needs to be asked, well, are there opportunities for those to have more minimally invasive surgery? Now, we know that the research shows that often hip arthroscopy for the FAIs and for the labral tears, for those that don't have, and even, more hip preservation surgeries for those who have hip dysplasia tend to not do as well, or won't even be offered for those that have those arthritic precursors. So there's some evidence there really that pushes us away from it. But that's not for everyone. There are some that have those kind of mild arthritic risk factors that sometimes do well for more minimally invasive hip preservation surgery. So the question is that relevant or not for you? And if not, and you're going to be booking in for an arthroplasty, then the question is is the replacement the right option for you? Or do you need to start having the question about whether a resurfacing will be a better alternative? But there are pros and cons to that as well that we'll discuss in another video. Then it brings us to point 3. So what do you understand about the surgery? Now, actually, I've got another video that will be coming out soon on this channel about what to expect post-operatively, and I've got other hip replacement videos on the channel that I'll certainly kind of push you towards so you can watch. But what I would say here is, what do you understand about what hip replacement is? Now, look, guys, I don't necessarily mean go on YouTube and start looking up live theatre surgical videos on how someone has a hip replacement. But sometimes it can be quite beneficial to understand just how big this surgery is. And don't get me wrong, I'm the biggest advocate for it. I think that it can be life-changing. I think that it can really enrich and enable someone's life to thrive. But in order to be able to do that, it's kind of worth knowing what you're letting yourself in for, so you understand what to expect afterwards, and also what your expectations are from a kind of functional sport and exercise perspective. As well as the actual surgical procedure, because it's a big old procedure. However great the outcomes can be, it might be worth kind of looking into understanding, well, look, what am I letting myself in for? How long am I going to be in surgery? How long am I going to be in the hospital? When can I kind of get back to work? All these questions are things I've actually discussed in other videos, but you need to make them. This is the third point, like I said. These are things that you have to ask before you're booking yourself in. It kind of brings us into our fourth point as well, because the fourth point is, what do you understand about the actual replacement? Now, that can sometimes vary a little bit as well. Cemented, uncemented, ceramic on ceramic, all these variations sometimes will be terminologies that you'll come across, and a lot of it is governed by the kind of surgeon that you're seeing, the type of surgeon that you're seeing, and what their preference is in regards to the type of prostheses and the type of approach that they use. Now, that's absolutely important from the perspective just so you understand in regards to what someone is essentially putting into your body. But are there some that are better than others? It depends where you go, it depends what you read, and it depends on the surgeon, like I said, that you're seeing. Ultimately, some of the kind of key points of that I would say override that understanding of the prostheses is the right type of surgeon. You need to have a surgeon that you can trust. You need to have a surgeon that does this a lot. And you need to have a surgeon that understands really the importance of a collaborative approach. Not just you have the surgery, you finish the surgery, you have the x-ray, bosh, you're out the room. You need to have a surgeon also that really understands the relationship and the collaboration with post-op rehab to really enable you to get back to the levels that you want to get back to in a safe, structured and really efficient manner, to be honest. Now, this fifth point, I would say, is probably the most important point, right? Because you've got to consider this. You're thinking about what 5 things I need to make sure I really cover out before I have a hip replacement. And this fifth one is absolutely, baffles me that this still doesn't get asked. And that's confirmation that you know the pain is coming from the hip. Guys, you need to be sure, and the people that are treating you, the people who are assessing you, need to be sure that the pain that you're getting is derived from the hip joint. Now, an arthritic hip is a useful, from a clinical perspective, it's really, really useful because it presents in a way, symptom presentation, pattern recognition of the way that it presents is impressive in how varied it can be. You know, you can have an arthritic hip and have thigh pain and have knee pain, have some diffuse lateral shin pain. These things are just hallmarks of how varied a hip presentation can be. But you need to understand the limitations to how the hip would move, reduction in joints, stiffness, range of movement, whatever you want to call it. Also, you need to make sure that we do things like ruling out the back, ruling out any other components that could derive the same kind of pattern of presentation. So essentially, you need to nullify some other potential differential diagnoses to enable you to be able to be certain that the pain that you're getting and the symptoms that you're getting are because of that arthritic hip that looks like it's an arthritic hip clinically, but also from the radiographic evidence that you've looked at consolidates what our clinical suspicions were. That means essentially in the most simple terms, I thought I had an arthritic hip, I've been proved I've got an arthritic hip. Now, if I'm going to go for hip replacement surgery, I know that that decision is the right one for me. Now, unfortunately, some people go down the route of having surgery and that may not have been the right decision for them. So these 5 things are essentially your due diligence at making sure that if you're going to book in for a hip replacement, it's the right decision for you.